Yeah, this
Yes.
good to have you, Ezine. Ezine is one of the new moms in the UK. She has gotten both experience. She's not a first-time mom. She has been a mom in Nigeria, her home country, right? Yeah,
Yes.
and in the UK. So she's in a very good position to give us first-hand information on both experiences, what it's like. So before we go on, I would just like you to give us a little bit introduction about yourself and we proceed. Thank you.
Okay, my name is Ezine Ilogun and I live here in the UK. I've been here for roughly 4 years now, and I've had experience having children both in Nigeria and in the UK.
Good. Thank you so much. Yeah, so I know a lot of new moms and expecting moms this video will be very beneficial to them. So I really appreciate this opportunity that you've given to us to delve into your experience and learn from you. So this is going to be a great one for others out there that are looking for how to maneuver the challenges of getting pregnant in the UK. I, for one, I don't know. When I see pregnant women in the UK, I'm so scared for them. Like, I was like, how do they cope? Because I know what it's like managing yourself alone, not to talk of with a new being. It's not easy. So I used to be scared for them. Like, how do they cope? So this will really be beneficial to a lot of pregnant women.
Yeah.
So let's just go in. Let me not take much of your time. I know that madam is waiting to have your attention. So so please, can you give us a little bit about your pregnancy journey overall? Just a brief about your pregnancy journey. How
In the UK, right?
UK, yeah, yeah.
Yes. Well, it was actually really smooth. The first time I found out I was pregnant, what I was thinking about was my job because with the whole sponsorship and
Yeah.
everything, so you need to be looking at, are they going to sponsor me still? Am I still going to remain in the job? So, but I summoned courage. And it wasn't even up to 8 weeks. I went to my manager and told them.
Okay.
Yes, yes, but they encouraged me, and then that made me even get more. I felt more supported from my work end, and then of course my husband supported me. I had registration with the GP, and then the whole journey started with everybody being involved, midwives and doctors, and well, we had a very smooth journey
Oh,
after everything. Yeah.
great, great. Thank you. So we'll be dissecting these experiences bit by bit by going through the first step. Like, what were the steps you took immediately I know you've told us a bit now, but you're going to go more detail so others can know what to do once they find out that they're pregnant. So what were the first step you took immediately you found out that you were pregnant?
Yes, like I said, for me personally, I was thinking about my job
Yeah.
because if I just got sponsored on that job and I really needed to, maintain the job. So I haven't even been up to, I started the job in July and then I was pregnant in August.
Mhm. You waited for 3 months. Wow.
So it was more like, come, did you plan it to come here and get pregnant? That's what I was thinking. But the fact is, they don't think like that, really.
Yeah.
And some managers don't think like that. So I just went to them and what I was thinking was different from what they were thinking. They were like, oh, it's a very good news. That's fine. Do you need any support? Do you need anything? And that's how I did the job for. They said, okay, if you work up to 6 months before the delivery, we'll support you with statutory maternity and all of that. And I was happy about that. Then the next thing was to report to my GP, who then recommended a midwife next to me because you have to go to the midwife in the community where you live.
Yeah.
So I registered with the midwives, and then they started giving me appointments, checking up on the baby, checking me as well. I registered because I already have a registration with the GP. They recommended ultrasound scan, and then the routine antenatal
Mhm.
and everything. And then I was going for all of those. Good monitoring, multivitamin. They give free multivitamins. I had all of that, and well, the support from work, the GP practice, the midwives, my family as well, it all made the journey very smooth.
Oh, great. That's awesome. So I used to hear that they usually come to the home to check, like the social care, right? They come to the home to check where if the place will be comfortable for the baby and to ensure everything is in place. Is that true?
Yes, actually, they do that most times for first-time moms. They do
Oh,
that first-time moms, yeah. But being a third mom, a third-time mom, they didn't really, they didn't come to check. Yeah, they
they
just
were confident in you that you can handle things,
exactly,
about.
exactly, yeah. So they didn't come to do that check for me. No, but
Okay.
eventually after the baby came, they started coming. In fact, that was one of the things they came to check when baby came. They
Oh,
wanted to know where baby was sleeping, and thank
mm,
God I had a bassinet in the sitting room and in the bedroom, so
mm.
they saw it and they signed it off. Yeah.
Oh, great. Okay, so apart from the ultrasound, uh, I want to find out more about the kind of test you did. Apart from the ultrasound, were there any
Yes.
other
Okay.
tests?
Yeah, they did. There's this test that they do to check any abnormality. They did that check. Well, they asked if I wanted to do that check. They do that check, but I didn't do the check because I didn't want any pressure on myself. So some
Yeah,
other person might accept, but I didn't want any pressure. And I've already known that um, I've had very smooth pregnancies, so I
yeah,
trusted God that this was going to be a smooth pregnancy as well, and that the baby was perfect. So I didn't do that check.
of
And
course.
then they did a lot of blood checks because they wanted to know if there was any issues. They do tests as well, but they are not concerned about sexually transmitted infections or any of those things. No, they're
Okay,
just basically checking to see that you have good blood levels. So for me, they found out that my blood levels were low, and then they decided that I had to take iron tablets more than maybe a regular person, more than the one that was in the pregnant care. They wanted me
okay,
to take an extra one to boost
mm,
my iron levels. Yeah.
okay,
So that's basically the check they do. Then the other thing is every time you go for antenatal, they'll do a urine test. They'll measure the baby. That one is standard procedure. Yeah.
yeah. Check your sugar level too.
Yeah, they did that sugar test, yeah, glucose test at some
Yeah,
point in the pregnancy, yeah, to check if you were
okay,
pre-diabetic or pregnancy-induced diabetes.
okay.
Yeah.
And besides, based on your former pregnancy, there have not been any trait of any challenge or that. So
No,
it is
no, no,
nothing
no.
to worry about. Yeah.
Exactly.
Yeah. Okay. So you said you kept mentioning that you had a lot of support from the midwife and all that. Can you tell us more about that? The kind of
Okay,
support.
do you want me to compare here and back in my
Yeah,
country,
we'll
or do you
get
want
there. We'll get. I don't want this substation to look as if we are trying to downplay the other part of
okay,
another country or
okay,
whatever. We'll
yeah,
definitely get to that point, but let's just focus on what UK is or what you can obtain in the UK system, so that those pregnant moms in the UK can look forward to this because like I said earlier, information is power. If you are not well informed, you won't understand. There might be a lot of benefit, a lot of help that can come, but if you don't know this help, you won't get it. So if they hear from you the kind of help, assistance you got, they're like, oh, but I listened to this lady. She said she got it. Why am I not having this? Then they'll have to call.
yeah,
Can I have this? And then that's it. So
yeah, okay. In terms of the assistance I got from the midwife, it was basically when I had a challenge, when I felt there was anything wrong, I had them at my beck and call. In fact, we have this app where
sweetheart, sorry, darling. Oh, we are stressing you. I'm so sorry.
it's okay.
Mm,
We have this app where you can log in everything that's going on. It's called Badger Notes. So from the moment you're pregnant, that's one of the apps you install on your phone, and then
mm,
you start monitoring from week 1, week 2, week 3, everything that's going on. So on that Badger Notes, you can have a note sent out to your midwife. You can have a note sent out to your midwife that something, this is what you felt. You just put down your symptoms or whatever it is, and
yeah.
then they could also, when they do a blood test or run a check on you, they put down all those notes. So even when you get home at night and then you're just relaxing in bed, You can easily just look at it and, have informed decision on what next is going to happen or what you choose to do next. Do you get what I mean?
Yeah.
So the support I got generally was the fact that they responded. They were responding. At every point they responded, but it's not like I can walk in without an appointment. The only place I can walk in without an appointment is the walk-in center, which is like A&E. So you don't want to do that. You want to have an appointment. So I'd rather wait until 8 o'clock in the morning. I'll go to my GP to complain, or give them a call before they can see me. But if it was the midwife, I needed an appointment, and from the GP they can, reach out to them and then they would see me. But every time I went there, in fact, there was a time I was really, really unable to walk. And then the midwife, she signed me off work. She signed me off work and said, you can't be going to work like this. No, I'm going to call your GP. And then she called the GP. GP gave me a letter, and I was off work for a month because I wasn't working. Yes, and it really helped me to recover that period. And then I had COVID in the pregnancy as well.
Oh.
Yeah, while I was pregnant, I caught COVID, and they also supported me. In fact, like the whole pregnancy, towards the end of the pregnancy, I was practically off work for almost 2 months because pain came, and the midwife, she was really, she insisted, you can't go to work with this pain. You've had COVID, you have to stay, and they gave me blood thinning injections. That was, they kept insisting that I had to take them, even though it was very awful. It was awful because you had to give it to yourself, either through your thigh or
really yourself. You gave it to yourself. Wow.
Yeah.
My God.
But sometimes I was scared. I would ask my husband to help, and then I'm holding everybody.
I wonder, those that are scared of injection, how would they cope? Wow.
Yes, you have to do it, and you have to do blood thinning injection even at some point towards the end, because they are really worried about developing blood clots. So because I had COVID, they felt, oh no, there's something. I don't know the relationship because I've never heard it before. But then the midwife kept encouraging me, go ahead, take the blood thinning injection. It's just for 6 weeks. For me, 6 weeks is like, what? That's a long time. And you have to take it every day.
Every day.
But in the end, in the end, I would say that they were really helpful.
You were stabbing yourself with injection every day.
Yes, every day. Yes. Every day.
Really? I think, is it just because you caught COVID, or is it a general practice by everyone, every pregnant woman?
No, I think some people, it depends. If every individual is different. I had a friend who didn't have COVID, but then they still made her take it towards the end of her pregnancy. I think it's something about them being worried about blood clots. I don't know. And then for me, they said because I've had COVID, there's a risk of blood clots. And then they gave me, even after the delivery, they still insisted I have to take blood thinning injection as well. So I kept injecting myself again for another 6 weeks.
That must really be hard on you.
It was.
Do you like
hard.
injections? Do you like injections?
No.
Oh my God, I can't imagine. Oh my God. I for one, I love injection. I prefer injection to tablet. But for someone that does not like injections, 6 weeks. Hey.
If it was a one-off thing, just take it today and that's it. That's fine. But I dread every day, like, oh my God, 7 o'clock is almost here. I'm going to take this injection again.
Yeah. I'm sure you won't be looking forward to 7 o'clock. Can this 7 o'clock just pause?
As well. Do you know that I purposely missed it twice? And then I went to them, I said, I don't need it because I've not taken it for like 2 days. Can I just stop? And they said, no, you can't stop. Just continue the dose you missed and take it to the end.
Oh dear. I'm sorry you have to go through all that. Wow. It's a whole lot, I can imagine. All right. Thank you so much. So we want to know more. Are there any maternity benefits?
Yes. Okay. So, I said earlier that I was worried because of my job, and apart from sponsorship, I was also worried about money.
Yeah.
So, I work in the NHS. So in the NHS, when you worked with up to 6 months, during your pregnancy, you
Mm.
have your even if it's your first time, you're entitled to statutory maternity pay. I believe it applies to some companies as well.
Okay.
But well, it's not all the companies, because my sister, her company did not offer her, even though she worked for 8 months, they did not offer her. So in the NHS, they said if you worked up to 6 months before the baby is born, then you're entitled to statutory maternity pay. So the is like an affiliation between the government and your employer. So they were paying the first month, they paid me for what I'm supposed to earn in 6 weeks. They were not paying monthly. They paid what I'm meant to earn in 6 weeks. Then the second month, they paid what I'm meant to earn in 4 weeks. And then from the third month, they started paying basically what you're meant to earn in maybe like 1 week or 1 week plus or 2 weeks, something like that. So when people say it's half salary, it's actually not exactly half salary. It's not even up to half. It's not up to half. So from that third month till the 9th month, they pay you that half salary that people talk about. And after 9 months, they don't pay you anymore. So some people either return back to work or stay at home for the remaining 3 months without pay. But if you're not working, you can also register with HMRC. With your the midwife gives you something called MAT B1 at 25 weeks pregnancy. When you're up to 25 weeks, you request for that MAT B1. Even before 25 weeks, you have to let them know. When they give you that MAT B1, that's what you would use to send to your employer, or you send it to HMRC. There's always the address behind where you can send it to. Even on their website, it's there. Then when you send it to them, you apply. So HMRC, they would have seen that maybe you were working before you became pregnant, or maybe you were not working. Whatever it is, based on your individual circumstance, they can now decide. And every 2 weeks, HMRC, the person I know, they were paying direct because she wasn't working. They were paying her like maybe like 300 and something pounds or 400 and something. Yeah, every 2 weeks. Every 2 weeks, yeah.
Really?
Yeah. So you get that's still called statutory maternity pay, but this one is direct from the government. So when you're getting it from your employer, it's almost the same thing. It's a bit higher because they give me at the end of the month, and it's not even up to 800 times. But then for the person who is getting from the government directly, 250 pounds every 2 weeks. In 4 weeks is 500. Sometimes it's higher, depending on the number of weeks for that month.
Because let's say is this determinant on how if you were working, the hours you used to work, how you were earning, can the price be determinant on what you were earning?
With HMRC, I think it depends on what you were earning, like what your threshold was before you became pregnant or before you're going to have your baby. I think it depends on that. But they pay you no matter whether you're a student or a skilled worker or whatever it is, so long as you have right to live in the UK.
Can that be considered as a public fund?
No, it's not public fund.
It's not. Oh, okay. So you hear that it's not a public fund, in case you be scared that my right to work does not allow public fund, so I will not. It is not public fund. Go and get it. Thank you so much for sharing. We are still going furthermore. So at what stage will you say is acceptable to stop working? Is it based on personal ability, or there's a standard point, month or weeks you are into the pregnancy that you are meant to stop working?
Okay. Excuse me, please.
Sorry.
I'm trying to get her something so she stops bothering me.
Okay, that's fine.
Okay, so from my experience, most employers don't have like a defined date or time and say, oh, you have to stop work when you're 35 weeks. No, you can go on working until the day you go into labor.
Mm.
You understand? But then because of it depends, there are some people that when they are pregnant, they are very strong.
Yeah.
They can even go to work and use hoists and still give birth in the night.
That's true.
You know?
That's
So
true.
some people are like that. Yeah, and
Okay.
then there are people like me in my category that we cannot continue. We are not able to continue.
Oh my God.
So I think I stopped work in February and I had my baby first week of April. So
Okay.
February, March, that's
Match.
like eight,
Eh,
almost 9 weeks. That's not what, maybe like 30, 31 weeks.
Yeah.
Yeah. So I
Yeah.
stopped work like around 31 weeks pregnant, I stopped. So some
Oh.
people, like I have a friend too, it was the manager that said, you should stop, you can't continue because they've seen that
Mm.
she's not good
She's not
at
strong
all.
enough. Yeah.
Yeah, so they told her to stop, and it's not like you cannot start arguing and saying, I'm not going to stop. Is
Mm.
it your pregnancy?
Mm-mm.
No, they can see that you're not able to deliver optimally,
Yeah.
They don't, why would you keep stressing and why
Just
would you keep coming? Yeah. So, but some people, they'll still stop and they're going to be doing agency somewhere. I don't get
mm.
it. It's actually,
It's all about their own ability. If
it's
they can.
exactly, it's individual ability.
Yeah.
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 Personally, I stopped 31, I think it was 31, and then I stayed at home
Okay.
until I had the baby. Yes.
Oh, so while working with the pregnancy, I'm sure the organization carries out a risk assessment, and they try to make things make it comfortable for you to work, right? I think
Yeah, yeah, they did a risk assessment and then they removed some things that involve maybe pushing or coming in contact with some kind of patient.
yeah.
Patients have COVID, like in the NHS, working
Mm.
in the hospital, you come in contact with patients that have COVID and all of that. In fact, when I had COVID, it was an eye opener. They insisted, no, 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 no. Whether you're wearing a mask or not wearing a mask, don't come wait because when patient has COVID, is a flag. They flag
Yeah.
it that the patient has COVID. If we
Mm.
know. But if you
Mm.
don't know, like
Mm.
when you go on the bus, you don't even know who is sitting next to you if they have anything. So
Yeah.
yeah, but then definitely they did a risk assessment to make sure
Okay.
that everything was in place. Yeah.
Mm. Thank you. So, are there benefits for a child born in the UK? I know before in the US, before Trump, before Trump new policy, when you give birth in the US, the child becomes automatically a citizen of the United States of America. So in the UK, what's obtainable? What are the benefits of a child born?
Um, Benefit of a child born in the UK is that you have a birth certificate that says United Kingdom.
Okay.
And then when you go to the international passport, place of birth, United
The
Kingdom.
kingdom. Okay.
There is nothing else. Nothing else. There is nothing else because if for any reason you need to leave the country, you have to get BRP for that child,
Mm.
and if for any reason Home Office insists that you have to leave the country, you have to live with the child.
Mm.
The only positive side to it is some people decide that, oh, they're not going to leave the country for any reason, holiday, visit, whatever it is. They are going to
Mm.
be here for the next 7 years.
Mm.
After 7 years, that child automatically gets British citizenship.
After
You
seven
know,
years.
after 7 years, the child gets British citizenship, and the child doesn't need to have been on any BRP. Like some
Oh,
people will say, I'm on a skilled work, I need to apply for my child. You don't,
yeah.
it's not, they don't force you to. So the
Okay.
child can legally continue staying in the UK for the next 7 years, and then
Mm.
they would get British citizenship by naturalization.
Okay.
Do you understand? Yes. But then if you also apply BRP for them, apply for BRP, and then you get your ILR, the child
Mm.
will also get. But what's the essence when the child will get British citizenship after 7
Exactly.
years?
Exactly.
That's the benefits in there. But if so
Yeah.
long as you're here and you want to go to maybe Bermuda or you want
Mm.
to go to US or you want to go even back to your home country,
Yeah.
you need BRP to carry the child to cross
Out of
and
the
come back.
country.
It's not
Yeah.
crossing out because
Mm.
you can carry only birth certificate and cross out.
Yeah.
But
Yeah.
coming
But
back
going and
in is
coming
the
back. Yeah.
problem.
Yeah. Oh, coming back in. Yeah, you have to
Coming
show
back
that
in.
this child was born in there. Yeah.
Even if the child was, you have birth certificate to show, yes, my child was born in here. So what's the child's right to live here? So you need to apply for that BRP, dependent child.
Oh, yeah.
So that's
Yeah.
why you have to apply for BRP for that child, so
Yeah.
that it's not an issue for you, assuming you want to travel.
Mm.
So you
Mm.
like I'm Nigerian. I went to Nigerian embassy in London. I did a passport for my baby.
Mm.
But if I need to apply for dependent child visa for her, I need her passport. So it's
Yeah.
that passport that I'll use to apply for dependent child, and then they will grant her.
Yeah.
So even if I'm traveling, I have her own e-visa or her own BRP card before, or well, now it's e-visa. So I have her
Yeah.
own e-visa. It's on the system that she's
Yeah.
my dependent child.
Yeah.
So apart from that, there is no other thing. Yeah.
Wow. That's great. That's good to know. Okay. So we are entering into the critical aspect now, the delivery room. We want to know your experience in the delivery room. How did it go? What happened? We need to know how it happens here so that those that are full of so much anxiety that like, hey, maybe I should just go back to Nigeria and give birth. I don't know. These people, Nigerians, Nigerians, when you give birth, they'll wash you with hot water, do all those herbal things. And no, some people might be scared. They might not get that treatment here and all that. How? So just give us a little bit.
Okay. Let me tell you about my delivery experience.
All right.
In Nigeria,
Mhm.
I've had cesarean section,
Okay.
and I had my baby here as well with cesarean. Um, there's a slight difference. Well, let me not talk about let me not compare. Or do you want me to compare?
Please do. Please do. We would love to know. I don't mind comparing at this point. Let's just know what's the difference. So,
Okay, so
yeah.
in Nigeria, I let me start from the beginning.
Yeah.
I built a relationship with my doctor.
Oh, I'm so sorry. We have to pause here now.